Assalamualaikum and a very good morning. I will be talking about the treatments for this speech disorder, which is apraxia of speech, AOS, and dysarthria. So why do people with AOS or dysarthria go through with treatment is because it affects their speech clarity and also their communication, since it is also caused by brain or muscle issues. And of course, it requires professional therapy. In therapy, they will focus on their coordination, muscle strength, and also communication support. Now, I will be talking about apraxia of speech, AOS. And there are two treatments that I will be talking about. Now, I will be talking about the first therapy, which is speech therapy, or other known as motor planning therapy. This helps the brain relearn how to control movements of the lips, tongue, and jaw. They might know what to say, but they don't know how to say it. So the methods used are repetitions of sounds, words, and phrases. And they also practice simple sounds before moving to longer sentences. They use a lot of visual cues and mouth movements, demonstration from other people around them, or the therapist. And it is very slow and structured speech for their practice. The goal for this therapy is to improve their speech coordination and increase their speech clarity and accuracy. So for the second treatment, it's melodic intonation therapy, MIT. So one of the videos that I have watched, the therapist was teaching a stroke person how to regain his ability to talk. They know what to say, but they cannot enunciate it. So the techniques that are used is singing or chanting, using a rhythm while speaking, and also hand tapping to maintain a beat. For an example, as the video I have watched, the therapist played a background song and also over and over again repeatedly sang a phrase. So the patient will try to repeat what their therapist said in a sing-song voice. The goal here is to stimulate different areas of the brain involving the speech production. Hence, it will improve their fluency and also word production. The next one that I will be talking about is dysarthria. For this one, there is also two treatment processes that I will be talking. The first one is strengthening and breathing exercises. The exercises include tongue movement exercise, lip strengthening exercise, facial muscle exercise, breathing control practice, and speaking slowly and clearly. It will go something along the lines of anything to just practice their muscle movements. The goal here is to improve their articulation and also pronunciation. It strengthens the speech muscles and also increases the voice control and speech clarity. The last treatment that I'll be talking about today is the augmentative and alternative communication, AAC. So AAC is very, very common or very, very easily seen in our daily life. So the examples of AAC tools are communication boards with pictures or words, speech generating devices, our phones, mobile application that converts text to speech, symbol-based communication system. For an example that I'm sure even we've used unconsciously, which is a person that types a message into a device that reads it aloud. They type, and then the device will say it out loud for you. So the goal here is to support communication in the daily life, make their life easier, and helps individual express their needs and ideas more effectively. For conclusion, apraxia of speech and dysarthria are two speech disorders that affects a person's ability to communicate clearly, but they differ in their causes. One involves difficulty in planning and coordinating their speech movements, while dysarthria is caused by weakness or lack of control in their speech muscles, like I've said before. Because of these differences, each disorder requires a specific type of treatment. With appropriate interventions such as speech therapy, melodic intonation therapy, exercises, and communication support tools, individuals can improve their speech clarity and overall communication skills. Thank you!